To diagnose and stage upper GI tumors, the first thing that we really need is a biopsy to confirm that, one, a patient has esophageal cancer, and two, to understand which subtype of cancer that they have. Is it adenocarcinoma, squamous cell carcinoma, or another cancer type altogether? Then it's important to understand staging of the cancer or the extent of how much tumor a patient has. The things we want to know is how deep through the wall of the esophagus does a tumor invade. We want to know if it involves the nearby lymph nodes, and we want to know if other farther away lymph nodes or other organs are affected by the cancer. To do this, a gastroenterologist physician will often perform a procedure called an esophagogastroduodenoscopy, also known as EGD, where a flexible tube is inserted into the mouth and into the esophagus to visualize any abnormal areas and obtain a biopsy at that time. Once the cancer is confirmed on biopsy, the same proceduralist will perform what we call as a endoscopic ultrasound, also known as EUS, where a similar flexible tube is inserted, and at the end of the tube there's an ultrasound or an imaging device that can look and see how deep through the wall a cancer has invaded, and also the status of the nearby lymph nodes. A CT scan is also performed, often of the chest, abdomen, and pelvis, to understand the local extent of disease and if cancer has gone to other organs, as seen as masses on scans or nodules. And a PET scan is a different type of imaging which really looks at metabolic activity, and it's also used to understand the extent of disease. After we do these diagnostic modalities, we put the information together and ultimately stage the patient. Stage 1 to 3 esophageal cancers are essentially localized to locally advanced cancers, so they can range from very early invasion into the esophageal wall or have deeper invasion with lymph node involvement, with stage 3 disease being more advanced on that spectrum than stage 1.